I wish to update the nation on the present situation globally, regionally, and in Guyana regarding COVID-19 as of March 24th, 2020. The number of confirmed cases globally has reached the staggering number of 332,930, with the number of deaths globally standing at 14,510. The number of confirmed cases regionally stands at 37,016, with a total number of 465 deaths in the region of the Americas. With regard to the number of confirmed cases in Guyana, the number remains at 5. When we look at the area from which these 5 persons came from, they came from region number 4. Of the 5, there are 4 adults under the age of 60 and 1 child. The number of deaths in Guyana remains at 1. We have a number of persons quarantined by the Ministry of Public Health on the mandatory quarantine. There are 9 such persons. And the number of persons put in mandatory isolation by the Ministry of Public Health is 4. The number of persons of interest to us that are being followed nationally is 1 person. At one point, we did have 7 persons who were of interest to us, and to date, we have been able to eliminate 6 of those persons. With regard to the number of persons receiving psychosocial support services, let me just say that all persons quarantined and in isolation will be receiving psychosocial support from our mental health unit at the Ministry of Public Health, who is working along with the Ministry of Social Protection. The number of calls received through the toll-free hotlines as of yesterday were 543, and 90% of those calls came from region number 4. Since the last press conference, the ministry's response, 8 pillars set out by the World Health Organization, is as follows. The Health Emergency Operations Center, the HEOC, continues to implement the National Strategic Plan, meeting every 48 hours for updates in an effort to monitor the COVID-19 situation to mitigate the spread of the disease. Regional preparedness is also ongoing. Also, there is an adequate supply of testing kits and the PPEs for our medical personnel. Continuous education of the public through various media messages is ongoing. Let me inform you that we have been able to translate our messages in 4 indigenous dialects. Those are Wapichan, Makushi, Akawayo, and Patamona. We are currently working on the messages for persons living with disabilities. And through some of our international partners, we are working on translations into languages for our migrant population. Regarding the multi-sectoral, multi-partner coordination, the Ministry of Public Health continues to work closely with the following agencies: PAHO WHO, UNICEF, IOM, IAEA, and members of the diaspora. Locally, we are working with the Rotary Club, who has been doing several tasks in the area of sanitization. The other 7 pillars that we have looked at are risk communication and community engagement activities, surveillance, rapid response teams and case investigation, points of entry, our national reference laboratory, infection prevention and control, case management, and our operational support and logistics. Please do note that all I have just listed are the areas of intervention which touch on the 8 WHO mandated pillars. Best wishes to all of us, and whatever we do, please let us stay safe. Remember, social distancing and hygienic practices is to ensure that we can beat COVID-19.